Hello, greetings from Sri Shankara Cancer Hospital and Research Center. I am Dr. Aruna. I am from the Molecular Research and Molecular Diagnostics Laboratory.
Namaste Elarigu. So I am Dr. Sandhya. I am a medical oncologist at Sri Shankara Cancer Hospital. So the relevance of this talk is to create awareness regarding certain hereditary colon cancers of what me and Dr. Aruna will be jointly talking to you about. I'm a clinician. The clinician's perspectives on when the patient comes in front of us after treatment about how to be kept on surveillance or testing if it's a cause of hereditary inheritance or family member screening is what is relevant to us. And Dr. Aruna will tell you how in the lab when we send the patients for such testing, she would take them with counseling regarding the testing and how she carries out the testing as well. And of course, the clinical relevance of such testing will jointly discuss with you in this talk.
Dr. Sandhya, could you tell us a little bit more specifically about this inherited or hereditary colon cancer?
So whenever we talk about reasons for any kind of cancers, in general, if any kind of cancers we are talking about, so we have something as, some cause that we detect. And there can be, after all the testing, there are causes which we do not detect at all. It can be either a sporadic or idiopathic cause for that kind of cancer, or there can be a hereditary cause for such cancers. So what do you mean by hereditary is, there can be a particular cause for that cancer where the person, the index patient or the patient who has come with that cancer is having a wrong gene in their body, which could be making them prone for such cancers. And that wrong gene would also be circulating in their family members as well. So all the more relevance that yes, it is running in the family, and we need to kind of identify if yes, the culprit is a gene, and if so gene, we need to give some measures of screening for the family members also. So in this talk where we are concentrating on colorectal cancers, the most common genetic syndromes, when we call syndromes, it is a kind of association of different kind of cancers that run in families. It need not mean that the whole set of family members have colon or rectal cancers alone. It can be different kind of cancers with the gene, because of the presence of that wrong gene, they can be susceptible to. So in this talk, what we are concentrating are on two most important hereditary syndromes. One is the Lynch syndrome and the other is the APC syndrome. So when we talk about Lynch syndrome, these are the ones which cause colorectal cancers. So we know colorectal cancer means it is the cancer of the large intestine. So whenever a patient comes to our clinic, young patient, young when we call a patient who is less than 50 years a diagnosis, okay, that is when we usually identify such patients and suggest them for a hereditary testing, irrespective of a family history or not. The second is a patient comes at any age but has a significant history of cancers in their family. So whenever we talk about family members, we grade them into first degree, second degree and third degree with respect to their generations. The first degrees are their siblings, their parents and their children, and the second degree goes the next generation, and the third a little far away. So whenever we have a set of cancers, especially for Lynch syndrome when we are talking about, so if the first degree family relatives have colon cancers, rectal cancers, or such kind of cancers which come in this syndrome, like they could also have, females can have uterine cancers, ovarian cancers, breast cancers. They can also be stomach, pancreatic cancers and small intestinal cancers. So if they have such cancers in multiple family members, like in the first degree, if one member has such cancer, in second degree, if two family members have such cancers, and in third degree, if more than 3 family members have such cancers, then it becomes relevant to test that patient for a hereditary screening panel. The type of cancers which are associated with hereditary colorectal cancers is the APC syndrome. It is something called adenomatosis polyposis cancer. So here what happens is, sometimes it's a chance diagnosis that patient has some vague symptoms or some kind of symptoms related to the colon. They go to a gastroenterologist, they get a colonoscopy done, and when the scopist or the doctor sees the colon is studded with adenomas. So adenomas are polyps, these are mucosal projections. So any person who has more than 10 or more than 50 kind of such polyps or adenomas pre-existing is a patient who has to be screened for this APC syndrome. More so, the relevance of it is in their lifetime risk of association with cancers in the future. And this is when we need to identify such patients and then counsel them appropriately and send for those kind of testing. Yeah. So Dr. Aruna, if you can kind of enlighten the audience as to how is the test conducted and what is the type of inheritance? Why are we so bothered that we need to detect such diseases, and is it such a risky thing to be detected? So certain points that you can kind of highlight.
Sure. So this type of inheritance, like what Dr. Sandhya explained, that goes in a very typical fashion, is what we call as an autosomal dominant inheritance. See, every cell has two copies of genes. One you inherit from your mother and one you inherit from your father. So just like how what Dr. Sandhya explained, it is likely that you have inherited an alteration or a faulty gene from either of the parents. So very typically your risk of inheriting the faulty gene would be 50%. So like Dr. Sandhya said, of all colon cancers, about 3 to 5% could be this following this mode of inheritance, and therefore they become hereditary colon cancers. There are some genes which are very high risk factors for this type of inheritance, meaning to say that these faulty genes are a group of 4 or 5 genes. To name a few: MSH2, MLH1, PMS2, EpCAM. These are high-risk genes which carry these faulty patterns of mutations, or what we call as genetic alterations. And if you have inherited this from one of the parents, or it is likely that it even skips a generation, your parent could have been a carrier and would not have had the disease, but your second degree, that is your grandparents or your parents' siblings, may have had the gene as well as the disease. This is a pattern of inheritance that we try to track when you come, when the clinician has identified you as a high-risk member. So when you come to our lab, we do a pedigree chart of who in the family has had the disease, how many people in the lineage have had the disease and are likely carriers, and then we go on to do the testing. So the risky individuals are, as Dr. Sandhya explained, already identified in the clinic, and then they come to the laboratory for hereditary testing. So we look for these specific alterations on these specific genes, and then we decide whether this is likely to be a inherited colon cancer, or what we call for non-inherited cancers are all termed as sporadic cancers. That means the inheritance of mutations are not the reason, or they are not the reason or causes for why the cancer has come to this particular individual.